The next big revolution is wireless health. The convergence of sensors, communication, and health sciences. With continuous monitoring, we want to know what people are doing 24/7 around the clock. And if needed, intervene right away as opposed to wait for 6 months or a year.
One of the breakthroughs that has enabled this is a merging of the technology that brought us low-cost microelectronics and low-cost computers with sensors. So many of these sensors now are composed of the same silicon technology of which microprocessors and memory are composed. And this breakthrough that's taken some decades to realize is now upon us. It's mature.
Instead of a doctor looking at a patient and making guesses in terms of its health, making everything not subjective, making it based on proven data.
Wireless health begins with medicine and with advancing outcomes for individual subjects and for entire communities.
I got wind of this and asked them if they would be interested in looking at people who are disabled, whose movements are much harder to characterize. And they basically said, "Where have you been all of our lives?"
We're working with Dr. Bruce Dobkin, and he's shown that even a modest level of feedback has an immense impact on the activity of stroke recovery subjects.
What we really want to know is how do our interventions affect their daily life? And the only way to do that is to continuously monitor measurable aspects of their movements.
You know when you are running out of gas continuously, or how close you are to running out of gas. It's not like you go to a mechanic once a month and say, "Can you check my gas level?" That's how medical community practice healthcare today.
The physical environment of UCLA offers another advantage for the growth of wireless health. We are highly integrated.
We have the best medical school next door, literally 5 minutes from my office. That also encouraged me to start looking at the intersection between medical science and engineering.
When I did find out that the School of Engineering had their programs and that they were willing to work with us and to support the development of remote monitoring devices, it's like I just jumped at the opportunity. They have an iPod at home connected to their phone line, and they transmit the data to a central system. The device will allow us to monitor them, and then it also allows us to give them feedback.
The sensors we use and where they're placed continues to expand. It begins, for example, with the feet.
You have sensors which shows how you are stepping on the ground. Once you have all these data, how do you analyze this data? The technology is going to be crucial in analyzing the data.
We've come in and taken some of our interior linemen and had them striking a blocking sled with wireless sensors in it, and then that information goes into the computer. With that information, we can evaluate our coaches on, our coach will stand there and be able to give an assessment of how well they think the athlete hit, and we can measure that off of actual data of how hard they actually hit.
It will tell them how to tell the athletes how to repeat the good performance.
That's one of the powers of being at a school like UCLA and being able to collaborate with all these different groups like UCLA Wireless.
The problem is defined by medical community, by coaches, and by patients and athletes. Then we go to the lab and start working on the technology. Then as soon as a version is ready, those are given to the doctors for their evaluation.
Eventually, we'll have things inside our body. The only problem with that will be that you won't be able to take a shot of wine without, your doctor knowing. Servers and the interpretation of activity data can eventually greatly cut the cost of healthcare by reducing the number of times people had to come in to see physicians.
Nothing in the past compares with wireless health. With the combination of impact, national, international, the inspiration it provides to students, its inherent match to our campus, and the business impact it can have here on California and the rest of the US and the world.